Henry Jenkins is famous for his criticism, involvement in entertainment, IDEA, media history, networks, new media, educating the next generation of journalists, popular and public culture, and social media. Jenkins' background is a Provost Professor of Communication, Journalism, Cinematic Arts, and Education. Through digital media, he gets his point across regarding the addiction of opioids in American society. There is one article in particular I'd like to address. Henry Jenkins wrote pertaining to the severe opioid addiction in society. A rash of deaths in Georgia had law enforcement stumped in performing autopsies. It was causing a backlog of bodies with no room to perform the necessary labs for forensics to release the bodies to the families. This is a growing epidemic of opioid addiction and death within American society. This has caused a surge in some states like Georgia for immediate autopsies to be performed so the families can grieve. This rise in overdoses are increasing from 776 deaths in 2013 to a quarter of this number already in the beginning of 2017. Physicians have prescribed opiates for many years to patients who suffer from pain. Some of these types are morphine, heroin, codeine, hydrocodone, oxycodone, methadone, and methadone. Opium is the basic ingredient in many of the opioids we see on the market. Not only do opioids help with pain, but they are a strong anti-anxiety medication and can cause a high if taken in large doses. Individuals who are addicted to painkillers or opiates will have problems in maintaining jobs, family, friends, developing a tolerance, and a problem in controlling or discontinuing use. The media is contributing to the spread of information regarding opioid addiction. However, the accuracy of this reporting comes into question. In actuality, there is significant evidence that 90% of so-called opiate overdoses is related to using two drugs at once. It would be, for instance, taking heroin and cocaine at the same time. The media should be focusing on the use of multiple drugs at the same time. There is another additional myth spread by the media regarding opioids being a gateway drug to heroin use. Actually, within the United States, there are twice as many overdoses due to painkillers as there are to heroin. Opioid overdoses are rarely instantaneous. Overdoses happen as a process. Someone slowly stops breathing. They usually happen 1 to 3 hours after the drug was used. Someone found dead with a needle in their arm is a rare event that is sensationalized. The media is focused on recovery programs such as AA, NA, rehabs, and detox. The public views movies such as 28 Days starring Sandra Bullock, where she enters a rehab for alcohol addiction. Now within this film, Bullock attempts to gain access to opioids to alleviate her detox symptoms. This is something many addicts view as a way of coping with detox and dealing with the pain of counseling for their problems. Facing the reality of what is causing the addictions is too painful for many addicts to face. In conclusion, media coverage of this heartbreaking opioid addiction has hit every home in America. This battle isn't fought on a battlefield or in the trenches of a war zone. It's in our country, cities, towns, communities, and homes, right in our medicine cabinets. The younger generations are not struggling with the addictions of the past. This is a new addiction, and it needs to be stopped before it destroys American society.